Today you will learn the top 5 important things you need to know before dental implantation that you won't be told about in other dental clinics. The first thing to prepare for after dental implantation is, of course, swelling and bruising. Everything, of course, depends on the individual characteristics of each body, but the swelling can range from pale yellow to cast iron black. And as they say, there is an unwritten rule that the stronger the bruise or the more severe the swelling, the better and more quality the healing. Why is that? Because the body directs resources to the area of strong swelling and bruising. All its reserve properties, all its protective properties. Therefore, indeed, recovery is much faster and of higher quality. How to minimize bruising and swelling? Most often, we, of course, talk about swelling or bruising as some kind of cosmetic defect because it does not bring any pain except perhaps discomfort. Therefore, we try to minimize it. The first method is, of course, using cold. That is, the patient applies cold for 3 days at specific times with certain intervals. For example, in our clinic, we provide the patient with an ice pack to take home. That's the first step. And secondly, of course, on the 3rd and 5th days, you can start using the so-called ointments that help dissolve bruises or lead to their quick disappearance. Therefore, most often in our clinic, we use Badyaga ointment. So bruising and swelling are not bad. Apply cold and use ointment if necessary. The second issue is an increase in body temperature. Body temperature can rise up to 38 degrees. This is absolutely normal. It's a protective reaction of the body to surgical intervention. Therefore, usually within the first 3 days, the temperature normalizes. Also, there's no need to be afraid of this because most often non-steroidal drugs are prescribed for the first 3 days. Therefore, these drugs also serve as, besides being pain-relieving and anti-inflammatory, they also have a so-called antipyretic effect. Therefore, your temperature will normalize immediately after taking these medications. The first 3 days, but if the temperature persists for a prolonged period of time, more than 3 days, you should absolutely and without hesitation contact or call your attending physician immediately. The third point is the so-called semi-bed rest. It's better to spend 3 days after the implantation procedure at home in front of the TV with a book. Let's say only get up when necessary or to eat and stay in this semi-bed rest mode for the first 3 days. So we advise you to prepare in advance. For example, take small leaves, days off, or a mini vacation for literally 3 days. The fourth thing you need to know is about nutrition for the upcoming week. That is the main dietary requirements immediately after implantation. This is what is called thermally, chemically, and mechanically gentle food. What does this mean? It means nothing spicy, salty, sour, extremely hot, and of course coarse. Therefore, your food should be, well, at least for the first week, let's say something like porridge or puree, so that it's comfortable to eat. Some people make broth during these days, while others try to, let's say, stick to some kind of baby food. So, any food, the most important thing is that we follow these 3 rules. Thermal, chemical, and mechanical gentle food for the next 7, but also 5, what you need to be prepared for is taking special medications after the implantation procedure. Most often they are prescribed by the doctor either as a prescription. In our clinic, for example, we provide them immediately, that is specifically in what is called a medication kit, already assembled. But nevertheless, the doctor prescribes them. The so-called antibacterial therapy, anti-inflammatory. In our clinic, I repeat, POTAC, we supplement this with calcium-containing medications and vitamin therapy. All this allows us to achieve the most guaranteed and predictable result. And another important point that many patients overlook. We have placed implants, and after some time they will have artificial teeth, and some patients believe that artificial teeth do not require care, that they do not need to be cleaned. Because they are artificial and not subject to, let's say, the same influences as our natural teeth, this is a big misconception, so I always emphasize the care for artificial teeth. The care should be, let's say, even more thorough than for your own teeth. Therefore, the most important aspect is, of course, hygiene, whether they are your own teeth or artificial ones. So it's hygiene. Hygiene and, once again, hygiene. How will you take care of them? It's a regular toothbrush, that is a manual one. We must clean artificial teeth, regardless of whether they are on implants. Whether they are crowns on implants or crowns on your own teeth, hygienic care is essential. The use of additional tools, such as an irrigator. An irrigator is very effective in cleaning the spaces between teeth, or in cleaning the space between the structure and the gum. Therefore, we always use an irrigator, or let's say so, an electric toothbrush if you have one. Nevertheless, the hygiene procedures are exactly the same, whether you have implants or not. That is, hygiene procedures twice a day as required. And of course, don't forget to visit the dentist as required, at least once every 6 months. I hope my information was useful to you and will help you decide in the future whether implantation is suitable for you or not. Write in the comments. What did you learn first? What did you know about? For a long time now, give a like, subscribe to the channel, take care of yourself.